This is the Medical Field Force Protection Brief by Clinical Operations. The objective of this brief is to recognize proper personal hygiene practices associated with the care of the skin, hair, hands, mouth, and teeth, and clothing. Recognize proper personal hygiene practices associated with the care of the feet. Identify nutritional elements associated with maintaining good health. Identify physical fitness factors associated with the maintenance of good health. Recognize personal hygiene practices used to avoid disease and injuries associated with the environment. Identify mental fitness concepts associated with the maintenance of good health. Identify personal hygiene concerns for female soldiers. Personal hygiene. Keeping the body and clothing clean and dry is an effective means of reducing disease agents on the body. Hair care. Hair should be kept trimmed. Wash your hands as often as the mission allows. Shave daily. Skin care. Wash with soap and water as often as possible. Personal hygiene. Hands. Good hand washing. Keep your fingernails trimmed and clean, and do not bite your nails. Clothing. Dirty clothing harbors disease and germs that may cause disease. Care of the mouth and teeth. Brush and floss teeth at least twice daily. Foot hygiene. Wash feet with soap and water at least once daily. Socks should be changed daily as needed and washed. Taking care of yourself. Nutrition. Army rations provide a balanced amount of essential nutrients. Eat a balanced diet, maintain good hydration. Rest and relaxation. Rest is important to restore your body's vigor. 7 to 8 hours uninterrupted sleep is optimal. Protection from the environment. The ACU is designed to protect you from the environment and from disease-bearing insects. Rules for avoiding illness in the field. Don't consume foods or beverages from unauthorized, unimproved sources. Use some form of purification if using unimproved water. Don't contaminate the ground with urine or feces. Keep your fingers and other contaminated objects out of your mouth. Avoid unnecessary exposure to wet and cold. Avoid insect bites by keeping your body clean and wearing a uniform in a proper manner, using repellents, and using bed nails as instructed. Don't share personal items with anyone, i.e. comb, razor, toothbrush, towels, etc. Rules for avoiding illness in the field. Don't take a laxative for pain in the stomach. See a doctor instead. Don't throw food scraps, cans, or refuse about the camp area. Avoid contact with sources of disease, especially in areas where native sanitation is poor. Whenever possible, get 7 to 8 hours of uninterrupted sleep each night. Personal hygiene and the female soldier. The medical and health concerns for the female soldier are different from the male soldier. Females have different cleanliness requirements than males. Supplies. Baby wipes, panty liner and sanitation pads, cotton undergarments, non-deodorant tampons, contraceptive supplies. Female soldiers have access to bathing facilities daily during their menstrual cycle if available. Personal hygiene the female soldier continued. Increased incidence of urinary tract infections may occur during the field exercises or deployments. Medical care is necessary for vaginal discomfort, sores, swelling of lymph nodes in the groin, unusual vaginal discharge, painful or burning urination, or abdominal pain. Female soldiers may be at greater risk for dehydration in the field because of their reluctance to use the latrine during due to privacy or time constraints. Cold injuries. Two types of cold injuries, freezing and non-freezing. Signs and symptoms. Tingling, numbness, and changes in the color or texture of the skin. Prevention. Best done through proper planning and preparation for cold weather. Always travel with a bottle buddy. Ensure adequate break times. Freezing injury. Frostbite, produced by exposure to freezing temperatures. High altitude frostbite, produced by exposure to temperatures between 20 degrees Fahrenheit and 80 degrees Fahrenheit at high altitudes. Non-freezing. Hypothermia, trench foot, immersion foot, snow blindness. Clothing principles. Outerwear clothing properly worn is essential to survival. Clothing for cold weather is designed to accommodate a variety of weather conditions and activity levels. Avoid skin contact with metal objects and liquid fuels. Clothing should be layered, loose-fitting, clean, dry, and in good condition. Clothing. Benefits of loose-fitting layers. Layers hold air between them, providing extra insulation. Loose clothing permits good blood circulation to the extremities. Layering allows for the removal of excess clothing. Sleep tents. Respiratory disease is a major medical problem for military personnel and live in close quarters. Crowded conditions are often found at military training barracks, classrooms, dining facilities, tent cities, and deployment staging areas. Close contact coupled with the stress of military operations often puts military personnel at greater risk of respiratory disease than their civilian peers. The highest risk seen during basic combat training when individuals bring bacteria and viruses from around the world into crowded living conditions. These personnel are typically young and have immune systems that have been depressed from extended periods of physical and emotional stress, making them more susceptible to acute respiratory disease. Respiratory diseases. How are respiratory diseases transmitted? Infected people expel viruses when they cough, sneeze, or talk. Droplets are propelled a short distance and can either land or be breathed in by another person. How to prevent transmission. Individual measures. Covering coughs and sneezes with a tissue or shirt sleeve are effective ways to block infectious droplets and reduce the risk of transmission. Hand washing has been proven to be the most effective way to prevent transmission, but in the absence of hand washing facilities, instant hand sanitizers are also effective. Current space allocation guidelines. Square feet per person. Current space allocation guidelines set forth in DA PAM 40-11, Preventive Medicine, 22 July 2005, specify minimum sleep space allowance of 72 square feet of floor space per person to lower the risk of disease transmission. Following example. An open bay that is 90 feet long and 45 feet wide has a total of 4,050 square feet and should hold a maximum of 56 personnel. Care must still be taken to ensure that each person receives 72 square feet of floor space. Stacked bunks require 144 square feet of floor space if both beds are occupied. All available ability, including temporary facilities and tents when necessary, should be used to ensure this minimal space allowance. Spacing between bunks and head-to-toe sleeping. Leaders should provide at least 3 feet between bunks. Alternate head and foot positions on adjacent bunks to increase a person's breathing zone. Maximize available space in the bay or tent. A staggered bunk arrangement provides a greater distance between bunks without reducing the total number of bunks in the space area as if the bunks were all aligned. Do not crowd bumps or personnel in one area while leaving large open spaces in other areas if barracks are not at full capacity. Tear down excess bumps or place trainees in every other bunk to further increase the distance between occupants. This is an example of head to toe sleeping.